So hello everyone, welcome to Ask Me Anything session on breastfeeding. Myself, Dr. Tanima Singhal, and let me start the session. So I already have some questions which you already submitted. So I'll answer first these questions, and then if you have any other questions, you can just write in the Q&A box, and I'll answer them after I complete the giving answers of the questions which are already submitted by mothers. Okay. And from next time, if you want the answer to your question first, then please fill up the form which we usually send by our during the when we just circulate about this session. That time we also send a Google form to submit your questions. You can submit there also. So let me start the session. So first question is from Sarita. Can I start re-lactation for my 1-year child if he is on formula from the birth? So yes, Sarita, yes, it is definitely a big yes. For relactation can be started for a 1-year-old child. If the baby has been on formula feeding, that's not a problem, because you have to understand relactation is all about demand and supply. So if whatever the amount of milk the baby is taking as in formula milk or any other milk which you are giving to the child, we have to first start working on demand and supply. So if we start working on demand, the supply will definitely come. That is the beauty of this human body, that once you start working on creating the demand, the milk supply definitely starts coming. So I would suggest now, don't waste any further time. Don't get confused whether it will come or not. I have got beautiful stories of relactation. Today itself, one mother from Saudi, she is my patient, and she just shared me the pictures of her relactation journey. She started with 1 drop of breast milk, and now she has reached up to 60 ml of breast milk. So that is called as beauty of of nature and our human body. So please don't get like confused whether should I do this or not. Don't waste further time in procrastination. Start doing the work. Your body is a beautiful, beautiful, beautiful creation. It will definitely give you results. Okay. So next question is from Dr. Vidhi. How to increase breast milk supply and technique of proper latching? So how to increase breast milk supply? This I keep answering most of my, because this is a very common question which mothers keep asking me, how to increase the breast milk supply. So we have to always work on number one thing, demand and supply. If your baby is less than 3 months of age, obviously you have to create demand at least 10 to 12 times per day by your body. So if your baby is already coming on the breast, then try to directly breastfeed the baby for every demand. If the baby is not coming on the breast, then you have to create that demand by pumping. So this way you have to create the demand, and the supply will definitely come. But yes, you have to support your body also. If your breast milk supply is very less, the support can be given by hydration, by improving the flow of the milk, by giving some galactogogues, like I already suggest many of the mothers to take lactomagic powder and moringa tablets. And also there are some allopathic medicines, but that has to be taken under the guidance of lactation consultant. So if you are planning to have improve the breast milk supply, then you can contact us. We'll consult you and give you the treatment plan accordingly. And more of emotional support and having more cuddles with your baby, just having emotional like emotional bonding with your child. Once the breast milk supply, like when you start working on all these things in a holistic way, then definitely breast milk supply will increase. I have been working with mothers for so long, and I have seen miraculous results when the body is giving you such kind of results which you have never imagined. Every day we have so many mothers success stories which we discuss and we celebrate. So we want you to get those results for yourself also. So that's why girls, I always motivate you that just don't waste further time. Now is the correct time. Don't think that these many months have passed, these many years have passed. Should I work on this? I have already started. I have already taken consultation from this person, from that person. I know you would have taken consultation from many people, but what I can suggest right now, because the plans which I have done with mothers, with regular touch up with the mothers, I have made some protocols which are giving very good results. And now, as you know, that we have 3 more doctors in my team who are helping out the mothers, because now my patient base has increased so much that one doctor, I am all alone, not enough to help out the mothers. And don't worry whether they are other doctors, but they are all trained by me. My protocols I have trained to them, and they are helping out the mothers. And also we are getting very good results from them also. So that's why if you are really concerned about your milk supply, please don't wait further. Just get to us, and we'll try our best to give you the best protocols to get best results for you. But yes, we want full cooperation from your side also, to properly work on the protocols and come back with the results. And sometimes you might take little more time, but that's definitely a worth try, because you will get results sooner or later, but definitely you'll get results. Okay. Now, third question is from Sonali. How to shift 5 month? Yeah, and sorry, Dr. Vidhi, also about the proper latching. So proper latching, as I already informed, if your baby is less than 3 months, please try to have cross cradle hold. Cross cradle hold video, I have technique I have a lot of times shared. I'm just telling you alone again. You have to hold the baby little up. You don't have to bend down. You have to sit straight. Have proper pillows below you. Have your baby just turn towards yourself, and hold the breast in U shape from below, and bring the baby from opposite side. And when you're bringing the baby from opposite side, baby's head should be little extended. So chin should be touching the breast first near your this finger, and nose should be away from the breast. And when the baby is like extended, then when you are bringing the baby, just with the thumb, just tickle the nipple in the baby's upper lip. Once the baby opens a big mouth, latch the baby inside. Don't leave this breast, because if you leave the hand from here, because of the weight of the breast, the baby will again come on the nipple. So hold this hand and support the breast throughout the breastfeeding. You can just support your hand with a small stool nearby, so that your hand doesn't pain. This way you can have an effective latching technique. So this is called as cross cradle hold, and on my YouTube channel you will find it. So just work it out, just watch it there and practice it. And we have a dedicated latching expert in my team. So if you are facing issues in only latching, your milk supply is all good, then you can reach out to my latch expert. She is very good at helping mothers for latching. So you can reach out to her. So third question is from Sonali. How to shift 5-month-old baby from bottle to breast? Good question, Sonali. So basically, Sonali, if you have to shift your 5-month-old baby from bottle to breast, first you have to understand, you have to keep patience. Baby's 5 months old baby very well recognizes his or her bottle. So what we have to do, we have to keep patience. And what we can do, for every breastfeeding, like every feeding cycle, whenever the baby demands milk, we have to first try at least to get the baby on the breast. Now, sometimes mothers say, I try 2-3 times. It doesn't work that way. For every feeding session, you have to try to put the baby on the breast. If the baby rejects or refuses or starts crying, it's okay. Don't get worried. Then you can give bottle or palada or spoon feeding, whatever way, or cup feeding, however you are feeding. Whatever amount of milk you are giving, give half amount first, and then take the baby back to the breast. Try again. If the baby is still not coming on the breast, then you give the remaining amount of milk. But this cycle you have to do every feeding session. So this way, if you keep trying regularly, the baby will definitely come back to the breast. And if suppose you have tried properly for 1 week and still the baby is not coming on the breast, then I would suggest, please focus that baby should get mother's milk. If the baby is able to get the mother's milk, that is the best win for you. Not compulsory that it should be from the breast. You can pump out the milk and give it in the bottle. But please don't get disheartened if the baby is not latching. Don't leave your breast milk product, like working on breastfeeding. Still, you can give breast milk to your baby. Okay. So as I told you about how to bring the baby on from breast to bottle, the most important thing is keep trying for every feeding session, and don't work on a lot of techniques that I should follow this technique or that technique. First, try to get the baby on the breast for however the baby can come on the breast. Once the baby starts coming on the breast, then you can improve on the techniques and latching, like proper positionings and all that. And also, like, you can try different kind of techniques. Like if suppose one hold is not working for you, it is worth trying for other kind of holds. Maybe one position is not comfortable for the mother or the child, but other things may be. Okay. Next question is from Anuradha. My baby is 1.5 months. When he is calm, that time he will take breastfeeding. Otherwise, we have to give formula. Okay, so Anuradha says this is a very common thing. If you are very hungry, you will feel so irritated and you would like to have your food fast. Now, if the baby is already knowing that milk is there in the bottle, baby is 1.5 months old, the baby recognizes its bottle. So what will happen if you are making the baby, like you are keeping big gaps in the baby's feeding sessions, the baby will become very hungry. And when the baby will become very hungry, the baby will not cooperate with you for the breast. So that's why it is better to have frequent feedings, especially when you are bringing the baby from bottle to breast. Then frequent feedings is very important. When the baby is less hungry, there are better chances of baby cooperating on the breast. So that's why, just Anuradha, for you specifically, try to lessen the gaps between two feeding sessions so that the baby is not very hungry when you are trying for breastfeeding. Also, you can see for the hunger cues. For 1.5 month old, you can definitely see the hunger cues. So hunger cues, crying is a very late sign. Your journey, like baby is very hungry now. So you have to first calm the baby, give little milk to the baby, and then you try for breastfeeding. But if your baby is like not crying, you will see the reflex. If anything which is touching around the baby's cheek, the baby will move the head towards that thing. That means the baby is hungry right now. So at that time, you should try to breastfeed your baby. So this way you can see the reflexes and work on that. And this will definitely give you results accordingly so that you can work on bringing the baby from bottle to breast. And especially when you have asked that when he's calm, that time he will take breastfeeding. So when you know that when he's calm, he will take breastfeeding. So try to lessen the time between two feeding sessions so that he doesn't become too hungry for that. Okay. Now, next question is from Sri Rupa. How to increase my lactation as my low doesn't latch? So if the baby doesn't latch, I have just answered this question. That doesn't mean you can't breastfeed your child. It may be not direct breastfeeding, but you can still pump out or you can express the milk. But yes, I understand. Don't pump for very long hours. Duration is not important when you are starting on this journey of improving the milk supply. It is always about the frequency. Frequency is more important than duration of breastfeeding cycles. So when I see mothers pumping for half an hour, 45 minutes, it is not recommended. 10 minutes is more than enough for pumping, but obviously you have to do it frequently. So you have to work on frequency and not on duration. When you are doing regular and frequently, when you are expressing out the milk will definitely increase. But yes, I understand, because a random plan will not work for anybody of you. If you have to really work hard and get your breast milk supply up, you have to follow proper protocols and what proper like guidelines, then what you have to follow, because that has to be customized as per what is your requirement, what is your present status of breast milk, and how much you need to improve the breast milk supply. So that is why I recommend to reach out the team of experts so that we can help you about it. And I have dedicated like doctors with me right now whom I have trained myself. They are all trained under me. So there is nothing like that. You should wait for me to have consultations, because my consultation waiting periods are nearly 1 week. So if you are in a hurry, you want to improve the breast milk supply, you can definitely go to my other experts. You will just reach out to the helpline team. They will guide you about the consultation details. But please don't waste time and by thinking this, will it increase or not? And everybody says now it will not increase. Your baby is 2 months old. The milk supply will definitely increase if you start working on it timely and in a proper protocol way. Okay. Next question is from Dakshayani. Can you please suggest any Ayurveda breastfeeding medicine? So Dakshayani, for when you ask about how to Ayurvedic medicines for improving breast milk supply, the two things which I always recommend to my mothers is lactomagic powder and moringa tablets. These two things are 100% natural. The market preparations of Ayurveda or any kind of lactation supplements, they usually have preservatives added into that. If any one of you is using some lactation supplements like Galect or Lactare or Lactonic, Lactavase, Leptidine, what all you are using, Lactare, just see the dabbas. You can see on the container preservatives are added into that. And we don't recommend preservatives for breastfeeding mothers. It is not good for anybody because preservatives are not good, they're chemicals. So basically we have to see those supplements which are 100% natural. So the lactomagic powder and this moringa tablets, which I recommend, are 100% natural with no preservatives added into that. These two things you can try if you want to improve the breast milk supply. They also help in mothers' early recovery also. Now, next question is from Sonali again. How to maintain adequate milk flow throughout 6 months. So adequate milk flow, Sonali, will be depending about your demand and supply. If you keep creating the demand for your brain, the milk supply will always be adequate for your child. Your body is a very smart machine. It will keep changing the composition of the milk as per the baby's growth. But yes, you have to create the demand regularly to improve the breast milk supply. Initially, if your breast milk supply is little less, you might need some help from outside like hydration. And as I told, hydration, so anyhow, you have to regularly maintain it even afterwards. But the other things like flow, galactogogues, weight checking, and all these things need to be done initially to improve the breast milk supply. And once the milk supply is good, then the maintenance can be done without any kind of external help. It is only by creating the right demand, and the supply will definitely cope up with the demand. Next question is from Sri Kanya. Sri Kanya asks, baby is falling asleep after 5 minutes of breastfeeding and cries later. What should I do, ma'am? Okay. So Sri Kanya, let me explain you the concept of active feeding and passive feeding. There are two kinds of feeding. Now, if you gulp liquid, okay, you can see the, the neck movement. So you will see the gulping. Same thing you have to observe while the baby is drinking milk. If you can see the gulping, that means the baby is taking milk inside. But you are not seeing gulping, only the movement of the mouth is there. That means the baby is not feeding, like not drinking the milk. So that is called as active feeding and passive feeding. When you can see gulping of milk, that is called as excuse me. So when you can see, when you're drinking, when the baby, you can see the neck movement. That means the baby is active feeding. But if you're not seeing the movement of the neck, only the mouth is moving, or you're not seeing the gulping, that means baby is doing only passive feeding. This you can observe when when your baby is sleeping. If you observe the mouth, the babies keep moving their mouth during sleep also. So that is the differentiation which you have to make while you're putting the baby on the breast. So when your baby is coming on the breast after 5 minutes and you feel the baby is sleeping, you just see the neck first. If there is gulping, that means the baby is drinking milk. If the baby is not gulping, that means the baby has slept. Now, why the baby sleeps on the breast after 5 minutes? Because the milk flow. If suppose only the baby is taking nipple feeding, when nipple feeding, the baby will not get adequate milk. It will be drop by drop of milk, and that will obviously make the baby tired, because the baby will keep drinking on, like keep trying, and then baby will get tired and then the baby will sleep. So that's why if you have to work, if you have to try for an active feeding, then you have to work on supply. You have to also work on the flow. If these two things are good, and flow you can improve by doing massage and the compress, and the supply you can work, as I told you, about like hydration, about your galactogogues, about taking the baby's weight and all that. So these things, if you just follow properly, your supply will improve and also your flow will improve. And obviously doing demand, like doing demand feeding every time. So this way you can improve your breast milk supply and the flow. And once these two things are good, just observe the feeding pattern of the baby. If the baby is doing gulping, that is fine. If the baby is not gulping, then remove the baby. The baby is doing only pacifying on the breast. So that's why you can remove the baby. So this way you can prevent your baby from sleeping on the breast. Next question is from Sushmita. How to know baby is getting enough milk and how to enhance milk supply? How to know baby is getting enough milk is by seeing the weight gain of the baby. So the baby is less than 3 months should gain 200 grams per week. So if your baby is gaining 200 grams in 1 week and is on exclusive breastfeeding, then you are doing well. Please don't get confused about it. If your baby is more than 3 months, your baby should, and up to 5 months, like 4.5 months, the baby should gain around 100 to 150 grams per week. Later on, once the babies are 5.5 months, 6 months, they should gain just 100 grams, or even like 100 grams is fine. 100 grams per week they should gain. So if the baby is gaining right weight gain, then you can just be assured that your baby is getting adequate breast milk. If your baby is on formula feeding and gaining more than the recommended weight gain. Then you have to start reducing the formula milk so that the baby gets more breast milk and the baby can maintain the weight of the body by having more breast milk. Next question is from Bandla Ramya, milk supply. So this is a random question, milk supply. I don't know what you are asking, just about milk supply. So I can't take this question because I don't understand what is the question. So next time, Bandla Ramya, if you're attending this live, please write your question in the Q&A box. And if you're not attending this live, you're watching it, then please just write. Next time you fill your question properly in the questions. Next question is from Abida. मैम सी सेक्शन के तुरंत बाद मिल्क सिक्रीशन नहीं होता, 2-3 दिन लग जाता है, सो इस टाइम हमें कैसे ब्रेस्ट फीडिंग के लिए प्रिपेयर करें? सबसे पहले आबिदा, ये गलत चीज, ये आपको ये गलत इन्फॉर्मेशन है कि ब्रेस्ट मिल्क आने में 2 से 3 दिन लग जाते हैं। जब बच्चा पैदा होता है तो ब्रेस्ट में मिल्क होता है, हमको बस उसका रिफ्लेक्स देना होता है। तो जब बच्चा पैदा होता है उसके आधे घंटे के अंदर हमको बच्चे को ब्रेस्ट पे ले लेना चाहिए। इवन नॉर्मल डिलीवरी हो या सिजेरियन डिलीवरी हो, दोनों में ही बच्चे को आधे घंटे के अंदर ब्रेस्ट पे लगना चाहिए। अगर बच्चा ब्रेस्ट पे लगा है तो पहला लेट डाउन, यानी कि जब बच्चा सकल करता है ब्रेस्ट के ऊपर, तो ब्रेन को पता चलता है कि मिल्क बनाना मतलब मिल्क को हमको रिलीज करना है, मिल्क बना हुआ है। प्रेगनेंसी में मिल्क सप्लाई होती है ब्रेस्ट में। जब बच्चा आकर के ब्रेस्ट पे फीडिंग करता है तो ब्रेन को पता चलता है कि बेबी की डिलीवरी हो गई है, और वो रिफ्लेक्स आता है, लेट डाउन रिफ्लेक्स जिसको कहते हैं, मिल्क रिलीज होना शुरू होता है। तो अगर आप ये कह रहे हो कि 2-3 दिन तक मिल्क नहीं आता, ये आपकी इंफॉर्मेशन सही नहीं है। बच्चे को आप फौरन डे 1 से भी ब्रेस्ट फीडिंग कराना शुरू कर सकते हो। विद इन हाफ एन आवर बच्चे को ब्रेस्ट पे ले लेना है। उसके बाद हर 1 से 1.5 घंटे के अंदर, हर जल्दी बच्चे को 1-1 घंटे पे ब्रेस्ट पे लगाना है। बच्चा जब पैदा होता है तो वो बहुत एक्टिव होता है। अगर उसको फॉर्मूला फीडिंग फॉर्मूला दे दिया जाता है तो बच्चे का पेट ज्यादा भर जाता है और बच्चा देर तक सोता रहता है, फिर वो ब्रेस्ट फीडिंग नहीं करता। इसलिए अगर आपको ब्रेस्ट फीडिंग करानी है बच्चे को डे 1 से, तो आप बच्चे को जल्दी ब्रेस्ट पे लगाइए, मसाज और सिकाई करिए ब्रेस्ट पे, जिससे फ्लो अच्छा हो। और बच्चे को आप रेगुलरली जब ब्रेस्ट पे लगाओगे तो मिल्क का फ्लो तेजी से आना शुरू हो जाएगा। और जब बच्चा पैदा होता है तब उसके पेट की कैपेसिटी सिर्फ 8 ml होती है, और उस समय जो ड्रॉप्स आती हैं कोलेस्ट्रॉम की, वो बच्चे के लिए सफिशिएंट होती हैं। तो आप उससे मत घबराइए कि मिल्क तो बहुत कम आता है, वो भी बच्चे के लिए सफिशिएंट है, बस आपको जल्दी उसको फीडिंग करानी है। तो इस तरह से आप डे 1 से ही ब्रेस्ट फीडिंग करा पाएंगे आबिदा, ठीक है। नेक्स्ट क्वेश्चन इज फ्रॉम नाजमी। बेबी इज नॉट लैचिंग, मिल्क इज नॉट कमिंग फ्रॉम द ब्रेस्ट, so this is interconnected. Baby is not latching, so milk supply is not coming. Milk is not coming, so baby is not latching. These two things are interrelated. So first what we have to work in synchronization. We have to put the baby on the breast regularly. If the baby is not coming on the breast, we have to try for the mid katori feeding, and again try for direct breastfeeding. If the baby is still not coming on the breast, then do pumping. So this way you have to try every time, and if the baby is not coming on the breast, you have to pump. So what will happen? There is a demand, and also you are trying for direct breastfeeding. So this way the baby will start coming on the breast once the milk supply starts increasing. So both the things can be done together. But if you are confused about the protocols, how to do it and how to manage everything, then obviously we are there to help you out. But the thing is that you have to follow proper protocols accordingly. Okay. So these were the questions which were asked on the sheet. Now let me start taking the questions in the Q&A box. Just give me 1 minute so that I can start working. Okay. The next question is from Dikshit Anu. 1.5 month baby boy not taking breastfeeding. When he was calm, he will take for 10 minutes and then he will push and he will not take again, start crying. So I think your question I answered already, Anu. I think you are the one who asked the question. For 10 minutes. Anuradha, yes. So Dikshit Anu, I think you have asked this question on the that form also, and I have already answered. Okay. So I'm moving to the next question. Pinky Dingreja. So she has written a big question. Let me take one by one. When, for number one question is, when in phase of cluster feeding, should I keep feeding the baby for continuous 4 to 6 hours? Can cluster feeding happen after 6 weeks of growth spurt? Also, if it can happen in gap of 4 days again, as it happened before vaccination and again after vaccination. Okay, so Pinky, there are a lot of questions in this. Let me answer one by one. So first question is, when in phase of cluster feeding, should I keep feeding the baby for continuous 4 to 6 hours? No. So first of all, you should understand what is cluster feeding. Cluster feeding is nature's way of improving the breast milk supply. When the baby asks for milk again and again, the brain understands the demand and it will start, it maintains the milk supply. That is good and that is in our favor to improve the milk supply. But we have to understand cluster feeding. During cluster feedings, babies are not very hungry. They just have that reflex of feeding on the breast again and again. So if your baby is on cluster feeding and asking for milk every half an hour, every 45 minutes, what you can do, you can lie down with the baby and let the baby feed. The only indication of giving any other milk is once the baby is on the breast and while suckling the baby is crying. That is the time when you have to give any other milk. But if the baby is coming readily on the breast and trying to feed on the breast, then please don't worry about giving any other milk. You just lie down in the sideline position so that you can take rest and you can feed the baby. Second question is, can cluster feeding happen after 6 weeks of growth spurt? So growth spurt is a different thing and cluster feedings are different thing. Growth spurt occurs at 2 weeks, 6 weeks, 3 months, 5 months, 7 months. So the growth spurt is a different thing. Now talking about cluster feeding is common till 3.5 months, and cluster feeding happens every day in 24 hours for around 3 to 4 hours. So during this cluster feeding times, the babies ask for milk again and again. And usually the cluster feeding times are in the evenings from around 5:30 till 8:30. Usually the babies do cluster feeding. Very rarely the babies are doing it in the night or in the morning. But this is only once a day. But if you are feeling cluster feeding is happening throughout the day, that means you are having low milk supply. Then you have to work on improving the milk supply. But if cluster feeding is happening only just once in a day, that is perfectly normal. Next question is, in the same question, Pinky has asked, again, as it happened before vaccination and again after vaccination. So vaccination is a different thing. Vaccination happens separately. That is a separate issue. You have just mixed all the three things. Cluster feeding is separate, growth spurt is separate, and vaccination is separate. All the things are separate. Okay. Next question is from Pinky again. How to use moringa powder to increase breast milk and which brand? So I don't recommend moringa powders because previously when I used to ask the mothers to take moringa powder, that became very difficult to take because moringa has a taste like henna. Many mothers were not able to take the powder. So that's why I now recommend moringa tablets. I recommend Dr. Mix moringa tablets as they are 1000 mg tablets. So the dosage is the correct dosage which I want. So that is one tablet 3 times a day if you are working on improving the milk supply. If you are only maintaining the milk supply and your milk supply is all good, you are just looking for maintenance and your recovery, then you should take once or twice per day. Okay. So next question, how much time should we offer feed per side? Now, this is again a very tricky question. Why? Because every baby is different. So like as adults, we might take one chapati, we might take 5 minutes, somebody might take 10 minutes, sometimes somebody might take 20 minutes to finish that one chapati. So in the same way, a feeding session is different for every child. What we have to see the active and the passive feeding. If you can see the neck of the baby moving regularly, that is an active feed. But if the baby is gulping, so you can't see gulping in the neck, so that means the baby is passive feeding. So you have to see the active feeding. If the baby is doing active feeding and finishing the breast in 10-15 minutes, it is fine. If the baby is doing active feeding and staying on the breast for 30 minutes, that means you are facing flow issues. So you have to work on improving the breast milk flow. Okay. Next question is, food and fruits a mother should intake for baby's weight gain. You can take anything, whatever you want. Basically, it is about the protein intake. So try to have more proteins in your food. If you're a vegetarian, have more sprouts, have more whole grains, have more pulses, your paneer, like dairy products. And if you're a non-vegetarian, have 2 eggs per day and have it at least thrice a week. You should have twice to thrice a week, have some non-veg. So, and about fruits and fruits, you can take any fruit you want. Don't take too sugary fruits. Otherwise, you are all okay. Take seasonal food. Don't go for any fancy fruits, and you can just take regular, whatever seasonal fruits are available. Next question. Earlier, my breast used to feel heavy and milk also used to leak. Now it has completely stopped. It only sometimes slightly pain on sides. Does that mean my milk supply has decreased? As my baby used to gain 40 grams a day and suddenly it reduced to 27 grams. But during this period, he also got cold and cough. So when I spoke to pediatrician, he mentioned that generally kids lose weight when they fall ill, but still concerned through the question. Okay, Pinky. So first of all, let you understand heaviness of breast or leaking of breast doesn't indicate the milk supply. Heaviness and leaking only indicates about the oxytocin reflex that has no relationship with milk supply. And this heaviness and leaking is not like it is not compulsory for every mother to feel. Some mothers may have it during first 6 weeks. Some might have it throughout the breastfeeding. Some might not have it anytime. So heaviness and leaking doesn't indicate about the milk supply. So just relax there. Now, when you said the baby used to gain 40 grams a day and then the baby reduced to 27 grams, even 27 grams per day is good. So that's why don't worry. The baby was ill. That's why the baby didn't win. Your pediatrician was right into that. So what you have to see now, you can cover up the milk. Once the baby is good, then you can do the feeding regularly, demand feeding, try to do frequent feeding so that his weight gain is good. And as I just informed you about the weight gain, about what should be the ideal weight gain. If your baby is falling into that correct whatever things I told you about, like less than 3 months should gain 200 grams per week. So if your baby is falling in those cycles, then please don't worry about the weight gain also. Okay. Next is, I have flat nipples. I don't use shield. Sometimes after feed, my nipple looks pokey and sometimes it looks pressed. Is it normal? Okay. So I'm good that you are an observant mother, but I would say that flat nipples doesn't mean that you have to use shield every time. In fact, I don't prefer shields because if you use shields, the baby does more of the nipple feeding. We have to feed by areola, and thankfully all mother have proper areola. Nipple doesn't have any role in like having a good deep latch. Nipple basically helps in just letting the milk flow from the breast towards the baby's mouth. So please don't worry if you have a flat nipple. Having a cross cradle hold, like holding the breast in U shape and supporting the breast, will give you better results. So don't worry and don't use shield. I don't prefer shields by myself. Next question is from Dikshit Anu. He will open the mouth, but he will not close the mouth and he will not suck and start crying. Okay, so what will happen? What happens usually when the babies are introduced to the bottles, they forget the feel of the skin. So what you can do, like whenever you want to breastfeed the child, just take your put your small finger in the baby's mouth, and once the baby starts suckling the finger, remove the finger and take the baby on the breast. So this works. So because babies usually sometimes they are just get confused, they have nipple confusion, whether this because they start recognizing the bottle as a plastic and those kind of silicone things, and they don't understand what is breast, what is skin. So we have to first make them understand about what is skin. So like finger feeding and then taking the baby on the breast will help. So Anu, just try on that. Okay. Next question, if lesson time also, he will not take feeding. As I just informed, you just work on this first and let us know. Next question is from Ayushi Shukla. At night, my baby is very violent while feeding. Violent while feeding. Okay. At night, breastfeeding is painful for me, and after 5 to 10 minutes, I have to give formula because I cannot bear the pain. At daytime, everything is fine. So that means I wish your baby is sleepy in the night, and when the baby is sleeping, the baby is doing shallow feeding. So what you can do, instead of giving formula milk, what you can do, you can just try to wake up the child. If the baby can, like if the baby is still not waking and you say that, but you are saying it is very, like baby is very violent, that means the baby is getting up. So what you can do, like you start with breastfeeding, but once it is painful, as you said, this 5 to 10 minutes, try the baby, wake up the baby and have a proper deep latch. So deep latching, as I just already informed you, first just tickle on the baby's upper lip, and once the baby opens a big mouth, then you just latch the baby. And if nothing is working in this way, then you just express the milk, and in the night you can just replace it with the formula milk. But try to give more and more of breastfeeding to your breast milk to your child. So you can express the milk and replace it in the by the formula, or you can just work by wakening up the baby. And some tips I'll give you on how you can waken up the baby. So usually I have mothers coming in my clinic, and when they are coming in the clinic, the babies are usually sleepy because they travel from their home to my clinic, and they are usually sleeping. So what tip we do, this hard table. What we do, we just put the baby on the table, just on the back head, we just put some pillow or something like that, and let the baby sleep on the table. And you know, our babies, they love soft things. So once they are put on the table, they don't like that feeling and they get up. So this way you can, I know this sounds funny, but this works. So you can work on this. And if it is not very cold and the weather is fine, then you can just have little wet towel and just wipe off the baby's face. The babies usually don't like that and they get up. So these tips you can try to wake up your baby. Okay. So next question is from Neelam. Neelam says, I don't have milk supply in daytime, but during night I have enough milk supply. What would be the reason? Okay, so in night, usually there is a prolactin hormone secreted in the body between 12 a.m. to 5 a.m. Prolactin hormone helps to improve the milk, like it is responsible for making milk. So that's why you are facing good supply. You are having better supply in the night, but not in the day. So what you can do, the simple concept of demand and supply. In the daytime, just put regularly your baby on the breast, and once the milk supply, like demand is improving, the supply will also get good in the day also. And the other things which I mentioned, like hydration, flow issues, and galactocox, the medicines which I just told, all these things you can try, Nilam. And if it's still it doesn't work, you can reach out to us. We'll try our best to help you out. Next question is from Sushmita. अगर CS सेक्शन के मोर देन हाफ एन आवर बाद भी हम बेबी को ब्रेस्ट मिल्क देने की कोशिश करते हैं तो मिल्क नहीं आता तो क्या करें? हाँ सुष्मिता, ऐसा अगर आपको ऐसा लगता है तो देखिए, अगेन बच्चे को तो आपको ब्रेस्ट पे हर आधे आधे घंटे पे लगाते ही रहना है. मिल्क सप्लाई अगर शुरू में आधे घंटे पे नहीं आया तो एनी हाउ आप बच्चे को अगर बाद में भी ट्राई करा रहे हो तो आप ऑब्वियसली उसको ब्रेस्ट मिल्क की सप्लाई बाद में आएगी. अगर आपको शुरू में ऐसा लग रहा है कि बच्चा भूखा पैदा नहीं हुआ है पेट से, ऐसा नहीं है कि बच्चा पैदा हुआ है तो अंदर कुछ को खाने को नहीं मिल रहा था कि बाहर आते उसको कुछ खिलाना जरूरी है. अरे आपके उससे उसको न्यूट्रिशन मिल तो रहा था. अभी ऐसा थोड़ी ना है कि बच्चा आधा घंटा हो गया पैदा हुए, आधा घंटा कोई मेहमान आ गया, भाई अभी तक कुछ उसको चाय पानी क्यों नहीं दिया अभी तक हमने. अरे बच्चा भूखा पैदा थोड़ी ना हुआ है. ठीक है, तो आप वेट कर सकते हो और आप बच्चे को ब्रेस्ट पे लगाते रहो. मिल्क की सप्लाई अगर इम्प्रूव नहीं हो रही है और आपको लग रहा है कि बच्चा बहुत रो रहा है और आपको मिल्क बढ़ाना ही है, बच्चे को देना ही है, तो आप शुरू में थोड़ा फॉर्मूला मिल्क उसको लेकिन कटोरी चम्मच से दीजिए. उसको बॉटल मत इंट्रोड्यूस करिए. आप कटोरी चम्मच से थोड़ा फॉर्मूला दे सकते हो. अब आपकी मिल्क सप्लाई थोड़ी इंप्रूव हो जाए तो आप बच्चे को ब्रेस्ट फीडिंग पे और मतलब रेगुलरली लगा सकते हो. लेकिन शुरू में भी अगर मिल्क सप्लाई कम भी है तो भी आप बच्चे को ब्रेस्ट पे रेगुलरली लगाते रहिए. ठीक है सुष्मिता. नेक्स्ट क्वेश्चन पारुल धाबी. 2 months बेबी के लिए कितना फीडिंग जरूरी है? ठीक है पारुल, देखो सबसे पहले ये समझो कि 2 महीने का बच्चा है आपका. आपके बच्चे का ब्रेस्ट बर्थ वेट क्या था? सपोज फॉर एग्जाम्पल आपके बच्चे का बर्थ वेट अगर 3 किलो था, ठीक है. अब बच्चा अगर 2 महीने का है यानी 8 हफ्ते का है, 8 हफ्ते के हिसाब से उसको 200 ग्राम हर हफ्ते में बढ़ना चाहिए. तो 8 हफ्ते के हिसाब से कितने हफ्ते हो गए, कितना वेट हमें चाहिए? 8 2 16, यानी कि हमको 1600 ग्राम चाहिए, यानी 1.6 केजी बच्चे का वजन बढ़ना चाहिए. तो अगर आपके बच्चे का बर्थ वेट 3 केजी था तो 2 महीने पे कितना होना चाहिए? 4.6 केजी होना चाहिए. तो अब आपके बच्चे का अगर वजन 4.6 केजी अभी नहीं है तो यानी कि आपको उसको मिल्क और देना है इसके अंदर. अगर बच्चे का वजन 4.6 केजी से ज्यादा है, मतलब अगर 1.6 केजी से ज्यादा, सॉरी जो भी आपको बर्थ वेट था उसमें 1.6 ऐड कर लीजिए. अगर उससे ज्यादा है आपके बच्चे का वजन तो यानी आप अगर उसको ऊपर का फॉर्मूला फीडिंग दे रहे हो तो वो कम करिए. अगर माँ के फीड पे है तो देन इट इज फाइन. ठीक है पारुल. तो ये ऐसा नहीं होता कि कितना मिल्क हमें हर बच्चे को देना है. हमको ये देखना है 200 ग्राम वजन बढ़ाने के लिए हमें बच्चे को एक हफ्ते में कितना दूध देना है. हम इस तरह से बैक से काउंटिंग करते हैं. ठीक है पारुल. नेक्स्ट क्वेश्चन इज फ्रॉम वानी कोदरी. So can we take all types of fruit or anything to be included? Is cantaloupe good? Good. So yes, you can take, definitely you can take all the fruits. There is no like I don't recommend, like, I don't have any kind of problem with any fruits. You can take anything. Like some mothers say, don't, I was not asked to take mangoes, and I have no problem with that. So just give me 1 minute. Yeah, so Vani, I was talking about the fruits. So you can take any fruits, whatever you want. And specifically when mothers ask me, can I take citrus fruits? Can I take this fruit, that fruit? Yes, all fruits are good. There is nothing like you shouldn't take any particular kind of fruit during your breastfeeding. You can take anything. And cantaloupe is also fine if it is available for you. So if it is available easily, go for it. Don't go for any fancy fruits. Whatever seasonal fruit is available, you can just go for it. Next question is from Tarannum Nazir. Ma'am, my milk supply is low during night time. Can you please suggest me how to increase it? See, Tarannum, the basic concept for improving milk supply is the same. Supply and demand and supporting the body. So if your milk supply is low during night, it means that there are big gaps during night feedings. So try to feed the baby regularly during night also. If the baby is sleeping for long and the baby is not getting up in the night, that time you can pump regularly. So anyhow, you have to improve the demand so that the supply improves, and you can support your body by the hydration and other things which I just suggested a few minutes ago. Okay, Tarannum? Next question is from Vani Kodri again. Can we take order? Yeah, I've already answered Vani. Next question is from Pinky. Yeah. My baby recently has started disconnecting while feeding. He does that for 3-4 times and also cries after this, and again latches. He does that often now. What does that mean? I check milk supply, it's there. That means that your baby is distracted a lot. If your baby is 3 months or above, it is very common. Around 2.5 months also, it is very common. So what you have to do, there are a few tips on reducing the distraction. Just lower the lights of the room. Just dim the lights of the room. Second thing, if the baby is babbling with you during feeding session, then don't respond at that time. Let the baby feed properly and peacefully. Once the baby finishes breastfeeding, then you just hug and cuddle your baby. So distractions you have to remove. And if your like room where you're feeding the baby has roadside, it is their roadside, then you have to shift inside. Also, if you have a joint family and there are a lot of people around, then obviously the babies will get distracted. So you have to work on removing the distractions, Pinky, and then it will be fine. Next is, I don't do pumping as my baby doesn't take spoon feed. He cries a lot. Most of the time, my pumped milk gets wasted. What in other way to handle this to increase milk supply? Also, should I start bottle feeding? Will it affect his latch for breastfeeding? Yes. I would not suggest you bottle feeding, but if the baby is not taking by spoon, then you can try palada. Palada feeding is very good, or cup feeding is very good. So you can try palada feeding or cup feeding. That is very helpful, and also it is easier than the spoon feeding. Also, there are some these days very lot of bottles are present which has a spoon attached to that. It becomes easy for to feed the babies if you don't want to bottle feed the baby that way. So you can also consider using those bottles which have a spoon in that attached to it. Next question is from Swapnali. Ma'am, I am trying to latch my baby, but every time he moves his face away from the breast. However, today he was sucking on my chin for a short time when I had lifted him up. Shall I try to give him a feel of skin this way by sucking on the chin so later he can latch? Just keep your chin clean then. I just feel that chin is not that hygienic instead of your finger. So if you feel that your chin is hygienic to put the baby on the for the like feeding, it's fine, and then you can try for but this chin will feel more hard for the baby. It will not be that favorable. So I would prefer going for like finger feeding first. With a small finger, you can just put in the baby's mouth, and once the baby starts suckling the finger, remove the finger and put him on the breast. Okay, Swapnali? So next, next is from Pinky. Can I have homemade fried items like bhajiyas and vada pav? Limited quantity, Pinky. It is not like good amount of bhajiyas and vada pavs. You can have limited quantity, like you can have 1 or 2 of bhajiyas and 1 or 2 of vada pav along with your healthy food. So once in a while, you can go for snacks, you can take snacks. But yes, I would not advise you to take it regularly on every day and a huge amount. So small amount of snacking is fine, Pinky. Next is from Parul, finger feeding is good or not? So as I just explained you to put the baby on the breast, if you are doing finger feeding for some time, it is fine. Like you're just exercising the baby for having suckling. But if you are asking the baby's finger feeding in the mouth, then I would say there are different things in there. If the baby is doing it for self-soothing, then it is fine. But if the baby is doing it like regularly for hunger, then fine, obviously you have to work on improving the supply. Next from anonymous attendee. Hello, ma'am. I have been trying to a lot to latch my baby. Shall I try supplemental nursing system? I came across this concept recently. While we're a small, I know that about it. While the other end is a disorder. So supplemental nursing system is good, very good, but it is like it is not that easy. So let me explain the supplemental nursing system. In that, what we do, we have the milk in a container, or there are like these days supplemental nursing systems available from Medela. So they have this a small container which the mother holds in her with a small string in her neck, and it has got two tubes attached to it. So that tube has to be pasted on the mother's breast and put the baby on the breast. So the milk usually comes, and this container has the formula milk or the express breast milk. Now what happens when the baby is put on the breast, the baby is suckling on the breast, the milk is coming through that pipe, not by the breast. But once the baby starts suckling regularly with this position, the reflex of the baby's sucking on the breast will improve the mother's milk supply. This looks very good and it looks very hopeful. But supplemental nursing system is not that easy because the babies don't like that pipe in their mouth. So when they come on the breast and they feel some tickling with that pipe, they just reject. So you can try doing supplemental nursing system. There is a easy version also. There is one more version where like you just take a feeding bottle, and from the nipple you just make a small hole, and there are feeding tubes available in the hospitals. Like for baby 6 number, a feeding tube is fine. So just taking the feeding tubes and putting one end in the bottle and the other end you are putting it on the breast. You're just sticking it with a tape on the breast and putting the baby on the breast. So once the baby starts suckling, the milk starts coming from the bottle, so that bottle milk, but it is because it is there on the breast, the baby, when the baby is suckling, the baby is getting milk from the bottle, but the baby starts suckling on the breast. That improves the milk supply of the mother. So this way, you can try supplemental nursing system, but I am just telling you that it is not very easy to do. You can try working on it and see if this works for you. This question is from another anonymous attendee. Does giving milk soon after head bath will cause cold to baby? No, this is a myth. Next question is from Madhuri. Is low hemoglobin reason for low milk supply? So now listen one thing. Low hemoglobin. If your hemoglobin is low, you have less oxygen retention capacity in your body. Now, if your body is not well, your body is already weak, there is oxygen carrying capacity less in your cells, then your cells are not very healthy, your body is not very healthy. Obviously, it will also hamper your milk supply. So if you are facing low hemoglobin, I would suggest working on improving your hemoglobin, and definitely it will work on improving the milk supply also. And with low hemoglobin, obviously you will feel too exhausted, too tired also. So Madhuri, it is really recommended to improve the hemoglobin for improving the milk flow. Next question is from Neelam Sanas. I missed your earlier communication because of network issue. Could you please suggest something to increase low milk supply? Neelam, you will get the recording of this. Don't worry. You can just go through the recording and you will understand the whatever advices I have given. So Apnali says, ma'am, for my 3-month-old, a 6 number or a 8 number feeding tube will be fine in SNS if I wish to try SNS feeding. So 6 number will be fine, Swapnali. You can go for 6 number and just take it from any, but you have to always change it for every feeding trials because the milk will be there in the SNS tube, like in that. So you need to like change the feeding tube every time. So Swapnali, you can try with that, but 6 number tube will be fine. So I think we are done for today. The questions are all finished. I'm glad that you all asked so many good questions. So I hope I was able to answer you all. Just write in the Q&A box if you really like this session, because that will encourage me to have more such sessions planned for you all. So there are 2-3 questions more. I'm just answering them. Till then, you can just write your feedback so that I can understand that you all are getting better results from, like, you are finding these sessions helpful, so that I can plan these sessions regularly as I'm doing it every week. So Pinky says, my baby is 50 days old. I used to feed him 40 minutes per side, and he used to sleep for 2 hours. Now he gets disconnected within 15 minutes of latching and wakes up in 45 minutes. So Pinky, is this happening for every 45 minutes? If it is, yes, then it is something which has to be worked upon. But 40 minutes of feeding is not like I would not recommend for that, because 40 minutes of feeding it will become too tiring for you, and the baby will also lose a lot of energy with that. So 40 minutes of feeding is not recommended. The feeding should be 15 to 20 minutes, which you're already doing now, but you are saying the baby is waking up in 45 minutes. Now this has to be seen whether he's doing it every time. If he is doing it every time, then obviously it is a concern. It has to be sorted. But if baby is doing once or twice like this, like during growth spurt, during cluster feedings, then it is fine. Okay, Pinky? Thank you so much, ma'am. Very insightful. Thank you. Okay. So good to know that you all like the sessions. Seeing the good replies. Okay, nice. Okay. Okay, girls. Thank you so much. So I'm just winding up this session. So you will get the recordings. Thank you for these hearts. So thank you. Ma'am, he does this during night. Pinky says he does this during night. So if it is doing only in the night, it is fine, Pinky. That means your baby's cluster feedings are in the night. But just keep a watch on this. If he's doing it regularly throughout the day, then you need to work on this. Okay, Pinky? Okay, girls, thank you for these hearts and your love for this. I'll keep doing these sessions for you all so that you get answers for your questions. Take care, everyone. Have a good night. Have a happy weekend. Enjoy your weekends. Okay, and give extra love to your babies. Take care.